Hello, my name is Lisa Singh. I'll be presenting Module 5 of course RSH 916, Problem-Based Action and Research. The professor is Dr. Mangan. This is for the Department of Education at Aspen University. Module 5's topic is defining the topic of interest using an action research plan. So there are a number of things that I'll be addressing. What is the problem to be solved? What goals you wish to accomplish with the action research plan? I'll discuss those. Who will need to be involved and the obstacles in circumventing those obstacles, solutions or interventions that may address the problem or challenge, and how I will specifically measure the effectiveness of the plan. Those things will be discussed. So I'll begin with the problem to be solved. I have shared with the class and Professor Mangan that I've practiced nursing for many years and have rendered care to the homeless. I understand that homelessness is a multi-layered problem and that caring for this population must involve systems and processes that address problems likely to be faced at each level. I was inspired by a patient who was homeless and still very much a caring mother to her children. The patient expressed a desire to continue her studies despite the economic and social stigmas she experienced as she resided in homeless shelters. Other patients have also expressed desires to obtain their high school diploma and/or obtain a college degree. Many, like this patient, have expressed feeling overwhelmed by the situations they find themselves in. This particular patient expressed a lack of resources and support in caring for her children and paying her bills as major hindrances to obtaining her educational goal. The main hindrance that she expressed was the unpredictable nature of being homeless. She expressed that at times she is bused to other shelters because of the time limits set at 30-day and respite residences. These depend on where she is on the homelessness spectrum. Most families can wait anywhere between 5 to 10 and even more years for an apartment for stable housing. So she noted that it was very unpredictable. It was difficult to settle herself into an environment when that environment was often changed from one residence to the other. So what goals do I wish to accomplish with the action research? So a goal that I wish to accomplish with the action research is to determine whether a tool such as a 5-minute meditation done before going to bed and before one begins their day might help to mitigate feelings of being overwhelmed by patients experiencing homelessness, lack of support and resources, and added stressors of motherhood. I have researched the benefits of meditation and wondered if the tool could be helpful in these types of situations. Another aim of the action research is to determine whether the tool may be useful with enhancing memory and understanding in the context of gaining one's education. I believe action research could be a helpful tool in mitigating these feelings, especially with the use of observation and the in-depth discussions that can be had with participants about their thoughts concerning the topics. And these often occur in the look, think, act phases of action research. Another possible deliverable is a model for meditation that will provide instructions and document progress that other homeless individuals may engage to mitigate their feelings of being overwhelmed. Such was the case with another action research project that I read. One of the activities that revolved around the look and act phases of Mehta et al.'s 2016 action research plan involved holding a community event. The event was used to engage stakeholders after other research activities such as quantitative questionnaires and qualitative interviews had been conducted to refine their data. There was an exchange of information among stakeholders and the authors, which allowed for further reflection, which in turn informed the planning and acting stages for a model that was designed to promote the use of services that could be used by small businesses. The model was called the Public Library Small Business Toolkit. The event also allowed the researchers to grasp the perspectives of the small businesses and librarians. The activity satisfied Stringer and Aragon's requirement that action research processes be human-centered, participatory, and promote equity and social justice. And that was done through the exchange, the information exchange, and the conversations had between all of the stakeholders in Meta et al. Study. And so all of that information was pooled to develop this toolkit with the aim of enhancing the economy in rural areas through librarian engagement with the public and those looking to access information. So who will need to be involved? What obstacles do we foresee, and how will I circumvent them? The most important stakeholder is the homeless individual, and care must be taken when engaging this vulnerable population. Other stakeholders include those rendering service to the homeless, such as the homeless shelter staff and the funding agencies. I will be asking these stakeholders for permission to engage the homeless in their shelter, but must be careful, as Stringer and Aragon 2021 noted, that the process of action research possesses the power to unconsciously disturb micro-political alignments and threaten people who have established positions of power or influence. Researchers are thus encouraged to enter settings with as much thoughtfulness and understanding of these dynamics as possible. Researchers engaged in action research are tasked with understanding the complex exchange amongst followers, activities, and events. Researchers must also make sense of the processes that individuals use to understand their circumstances, so that any research exercises can be perceived by the participants in the organization as relevant, practical, and beneficial. These stakeholders will be asked for time with the homeless individuals for engagement, in-depth conversations, and other action research activities that could interfere with their already set schedules. Following Stringer and Aragon's 2021 guidelines should prove helpful in circumventing these obstacles. Other possible obstacles are related to the researchers intentionally involving themselves in the research environment. The activity leads researchers in informally conversing with the people of that environment about activities, events, and participation in group activities or the community. The activity allows for the researchers to be visible to individuals in the environment in a hospitable and friendly way. Researchers working with homeless individuals would thus need to be aware of any hierarchical structures within their shelter or community center environments that could disrupt the homeless individual's quality of life or their ability to access services as a result of the research activities. The researcher must consider that scheduling appointments or meetings with homeless individuals may be counterproductive to the homeless person's access to services, as case managers may require homeless persons to attend pop-up meetings to continue services. Researchers are also encouraged to understand the processes that homeless individuals engage to make sense of their situation. The researcher must understand that the setting of the action research is any location where a homeless individual can meet with the researcher without causing undue burden for the homeless individual. So what solution or intervention do I propose for implementation? So Dahl et al. 2016 proposed mindfulness techniques that included meditation in their research and as an examination of practices that contributed to well-being. These researchers, they use their meditation techniques with college-age students. So these were an adult population. One of the practices was highlighted as focused attention, so that's in quotes, and included counting breaths for at least 30 seconds or until the individual experiences a state of calm, being aware of the sensations felt by the body. The individual would be encouraged to start from the top of their head and direct their conscious feeling of body sensations downward to the soles of their feet. So that would include everywhere from the top of their head to the soles of their feet, their neck, the back of their head, their shoulders, their chest, and then so forth. Another element of the focused attention was reciting mantra, which is a component of meditation. Individuals would be guided in positive affirmations as mantra or any others they wish to recite. Some folks may wish to recite Bible verses, meditate on those. Others may wish to, and the Another element of the focused attention was being conscious of sitting still and allowing supportive thoughts to culminate into a state of calm. The practices are rooted in Zen practices and serve as an intervention that is worth exploring. Dahl reported very positive results from the use of the meditation techniques that they used. They reported that college students were reported feeling calmer, and that calmness enhanced their memory. And so that's one of the aims of my action research plan. So how will I specifically measure the effectiveness of the plan? So Stringer and Aragon reported that an evaluation of the effectiveness of the plan is to involve self-reflection queries about whether the objectives and outcomes were indeed accomplished. Setting indicators of the success of the outcomes must be done, but must allow for themes that arise. If time permits, researchers may circle back to those themes with the aid of all stakeholders involved to further distill their data. The new information gleaned has the potential of aiding the researchers in addressing the effectiveness of the intervention. The information also furnishes researchers with an idea of what was not being done, what was being done that should not have been done, and what was needed. Measurement of the proposed meditation intervention would be gleaned from the qualitative interviews with participants and even quantitative questionnaires that allows participants to gauge their level of calm and the absence of feeling overwhelmed. And that was all taken from Dahl et al.'s 2016 study. I have superimposed them over ways that I would measure the effectiveness of the intervention. So thank you. This concludes my presentation of defining the topic of interest for my action research plan. I hope this was informative for you. Thank you.